We're presenting data at this meeting addressing the important question of whether one can develop effective salvage treatment options for patients who've relapsed after an allogeneic transplant for acute myeloid leukemia or myelodysplasia. As allogeneic transplantation comes to play a central role in the treatment algorithm of patients with AML and MDS, it's becoming an even greater problem, disease recurrence, occurring in up to 70% of patients transplanted in remission. And at present, the outcome for patients who relapse after an allograft is extremely bleak. The only effective treatment option is probably intensive chemotherapy, which is very toxic and often not effective. With the EBMT group, we've shown some activity of Azacitidine as a salvage therapy, but the response rates are lower than one would like. Lenalidomide is a very interesting drug to be used after an allogeneic transplant because it plausibly augments the graft versus tumor effect, but has previously been associated with excessive rates of graft versus host disease. We and others have demonstrated that Azacitidine expands Tregs and may have the capacity to reduce the risk of severe GVHD. And so in this phase 1/2 study, we combined Azacitidine with Lenalidomide and asked the question as to whether this agent Lenalidomide could be safely delivered post-allograft and also whether the combination was effective. And the results of this study that's been delivered by the UK Trials Acceleration Programme are supportive of the notion that actually much higher doses of lenalidomide than previously envisaged can be safely delivered in patients with relapsed disease. And the MTD was 25 milligrams of lenalidomide combined with Azacitidine. And we saw about 50% of the patients, just under 50% of the patients receiving this combination achieved a CR, and some of those patients remain alive after DLI or a second transplant. So this looks promising data in a very challenging population of patients in whom there's a major clinical unmet need, and we really support the further exploration of this combination, conceivably in the setting of a randomized study.